right, thank you everyone for joining us today. My name is Steve Pardue, one of the managing members at Elevate Oral Care. Today, our speaker is Dr. Paul Glassman. Dr. Glassman is the Associate Dean for Research and Community Engagement at the College of Dental Medicine at California North State University in Elk Grove, California, and Professor Emeritus at the University of Pacific, Arthur Dugani School of Dentistry in San Francisco, California. He's served on many national panels, including the Institute of Medicine Committee on Oral Health Access to Services, which produced the IOM report on improving access to oral health care for vulnerable and underserved populations. Dr. Glassman's a pioneer and has led the national movement to improve oral health using telehealth connected teams in virtual dental homes. His accomplishments are much more beyond what I've mentioned here, but in the interest of time, I'll turn it over to Dr. Glassman.
Great, Steve. Thank you so much for the introduction, and it's a pleasure to be here. We're all living in a different world than we were living in. I refer to it as ancient times, which was about 2 weeks ago. But certainly the rise of being able to connect in alternative ways using webinars and other connections has gone a lot. The idea of the internet being stressed is certainly because everyone's connecting with each other in just different ways than we did before. So it's nice to be able to have this connection with everyone today. So this is about teledentistry. We're going to talk about this theme, about bringing care to where people are, and sort of the new era for oral health. And I'm going to do this in sort of two different ways. We'll start with a little bit of historical background about the idea of teledentistry. I think something that hasn't been paid a lot of attention to in the world of oral health up until fairly recently, even fairly recently, not so much. But clearly in the environment that started a few weeks ago, there's a lot more attention to it than there was before. So we'll get a little bit of historical perspective, sort of laying the context for some more specific ideas and recommendations about what to do today. First, this slide on disclosures. I do a lot of consulting these days for various groups. I won't read the whole list to you, but that's sort of what my life is. I'm part-time helping to start a new dental school at California North State University, and then I do consulting for lots of different groups. Just as a little bit of context, I borrowed this slide from Dr. Karen Smith, who's the former director of the California Department of Public Health, which I think helps us to understand sort of the big changes that have been taking place even before COVID in our healthcare system, which is we're seeing an increasing focus on the idea of health versus health care. I hope it's obvious what the difference is. That there's a realization that it's no longer enough just to provide late stage repair, that it's important now to intervene in earlier upstream, as people say, in the social determinants of health. We have a population that's becoming older and more diverse and more complex, and sort of increasing interest in a focus on the community as a level of focus. What's the health of our communities as opposed to just what's the health of the person who sat in our dental chair a few minutes ago and is now walking out the door. And then, of course, the availability of big data and focus on value, and focus on collaborative systems is actually increasing the possibilities of even understanding what's happening at a community and population level and doing something about it. So very quickly, a couple things about the healthcare system, at least the oral healthcare system now. There's data from the American Dental Association's Health Policy Institute. Most people, basically the idea here is most people are not getting dental care. This is utilization by age group. The highest utilizers are children. It's actually, this is from 2015, it's bumped up over 50%, but still most children are not getting dental care. And it's very skewed towards the level of income. So population of children from higher income families much more likely to get dental care. Lowest income children, maybe only 20% are actually even having an annual dental visit. So without going through what would be in a different presentation, lots of data to demonstrate that. Just the conclusion here is that we have a dental care system that's been primarily serving the wealthiest and healthiest segments of our population, not exclusively, but primarily. And so that raises the question, how do we move into that different world that Dr. Smith is describing? And I would submit to you that these are the three main ingredients into moving into the new world. And those are measurement and payment systems. There's lots of work being done now to figure out how do you actually decide what good health is and how do you measure that and how you provide incentives for people to focus on things that produce the best health at the lowest cost. There's things that are talking about prevention and behavior science I'll mention in a minute. And then the focus of today is going to be on delivery systems. So just a quick idea on the three different circles here, measurement and payment systems. This is the only slide about that, just to demonstrate that there are lots of people very prominent in the oral health industry focusing on how do you actually develop payment systems and be able to provide incentives to produce better health and lower the cost. The second part of the diagram, prevention and behavior science, I really won't spend any time on that because you've had some great presentations about behavior support. This is just a whole list of things that we know can actually improve people's behavior. But the idea of getting messages from different sources by trusted members of the community, using motivational interviewing, starting small and building ongoing reinforcement. The conclusion from all that is that the only way to effectively change people's behavior is to be in partnership with community organizations where people can be interacted with over a long period of time, rewarding incremental changes. And so Matt Allen, in the presentation that he did last week on patient-centered communication, touched on a lot of the principles that go into helping people change their behavior. And then all of the new prevention science with remineralization and caries-arresting medications and sealing caries, that's the one that's coming up on Thursday with Jeremy Horst. So I'm not going to spend any more time on those. What I'm going to talk about today is really focusing on the delivery system. And even in there, just one aspect of the delivery system, which is teledentistry, and talking about how teledentistry can make a difference in our world. So teledentistry is kind of a broad term. I won't even bother doing the definition today, but just to talk about how it's been used across the dental industry now, lots of different ways. So everything from dentist to dentist interactions, dentists have always shared records with each other and maybe even with patients. Real-time video consultation, which is video conferencing. And when we get to sort of the immediate, what do you need to do now in the world of COVID-19, that becomes very important. So we'll come back to that. The idea of store and forward record review is sometimes called asynchronous, is beginning to attract more and more use. Patient and dentist interactions, somebody just taking a picture with their cell phone and sending it to a dentist for some kind of comment or advice or instructions. And we'll talk about that in the COVID world as well. And then even real-time video support, which seems like science fiction, but actually surgical support over the internet is becoming a reality. And mHealth data collection refers to those same kind of things done over using a smartphone or some kind of handheld device. And I'll spend just the next couple of minutes talking about this idea of using telehealth connected team delivery systems. So just to put the context for how teledentistry has been rolling out in the world of oral health, we've developed something and been working on it for close to 15 years called a virtual dental home system. The term virtual dental home refers to the idea that it's very prominent now, the term health homes or medical homes. The idea you're going to try to take care of someone, sort of the family idea. We're going to not let you get lost. We're going to teach you how to manage your own disease. We're going to get you to advanced services when you need them. And so the implementation of that, we call it the virtual dental home, showing we can provide all those services, but not in the physical bricks and mortar dental office, but through a team approach where different people are in different places. So how it's been working, here's a team of a hygienist and assistant with portable equipment. They can be in one place one day and a different place the next day, collecting, here's radiographs, collecting photographs. Can this be in schools and Head Start centers all the way up through nursing homes? And what they're doing in a system like this is they're collecting a full set of digital records, everything you'd expect to see in a fully populated electronic health record system, including all the imaging, charting, consent forms, health history, everything in a fully populated system. And so you have allied personnel that are collecting this data out in a community site like a school or a Head Start center or a nursing home or a community organization. And the dentist who's not on site is able to access the record in a cloud-based storage system, make decisions about what needs to be done. And I'll give you some data in a minute, but most people actually can be kept healthy by the things that can be done by the allied team in the community where they're living. So for example, in California, hygienists are allowed to place interim therapeutic restorations, which doesn't require any drilling and doesn't require any anesthetic. So no shots, no drilling. And in a low-income school, this child with that little hole in the tooth, what would normally happen is nothing until that hole got to be a bigger and bigger hole, and then the child is in school with a toothache and not really learning, or they're in the emergency room or even the hospital. And so with this technique now, in just a few minutes, that decay can be removed and sealed in place for a long period of time. And obviously, now something like silver diamine fluoride is even simpler, just a drop in that tooth, and you can stop the rest of progress of that decay. So we have new preventive tools now. And so we did a demonstration of these concepts across California in 13 different communities. And we're able to show that this idea of telehealth connected teams really could work. You can have different people in different places that were working together. And some of the key points were you could actually reach people who were not normally getting dental care. Many people could be kept and verified healthy on site. In fact, 2/3 of children, everything they need to have done could be completed by the hygienist on site. And this did really integrate the oral health into the community organization like the schools and brought the dentist in as well. And now we're working in about 40 different sites in California and a bunch of other states as well. The American Dental Association has a really good policy about telehealth, basically saying that it's a legitimate tool for dentists to use and dentists should be able to do it and get paid for it. And the idea is now spreading really across the country, even before the COVID era. Starting out in 2010, we were kind of doing this alone in California, although there's a little bit in some other states. And in 2014, started working with a few other states. In 2018, either working with or in some conversations, and in 2019, hearing about or working with more states, and in 2020. And what you can see is this is just really spreading across the country. So the idea of using telehealth connected teams is going to be everywhere. The number of companies that are actually delivering services is just growing astronomically. So if you did a web search today for teledentistry, you'd see many, many hits and many, many different companies. And we're really moving towards an era now where you can start to think about not just dental care in individual little offices here and there, but actually community engaged oral health systems where you have dental providers who are engaged in a system that actually involves and reaches the community. So the path forward for all of that, I call these the golden rings, is what I started out with, is the idea of incentive systems, measurement and incentive systems and payment systems that are going to reward providers for producing a healthy population. The use of prevention and behavior support science, which you've heard from Ed Allen and we'll hear from Jeremy Horst, and then delivery systems. But all of that was in ancient times, again, ancient times being 2 weeks ago. And now we're in a different era. We're in the era of COVID-19. So I'm going to spend the rest of the time today talking more about this topic, which is how do you maintain services and contacts with patients during the time of COVID-19 and all the physical distancing requirements we have now, and how can teledentistry tools and strategies play a role in that? So the stuff I just showed you maybe is a little bit of background and context, the fact that teledentistry is something that didn't just appear, but the use of it is clearly more on people's radar now. And also, I believe that what's going to happen in the next weeks or months, depending on how long we're still in physical distancing requirements, is going to have a big impact on the future. And so the idea of using teledentistry to deliver and stay in touch with patients in providing dental care is not going to go away. So the environment we're in right now, people are cut off from traditional sources of care. Practices are trying to limit services to urgent and emergency services, which is what they should be doing. Now what we have is a need to figure out, how do you establish communications with people? How do you provide advice and consultation and triage and do as much of that as you can, rather than have people come into an office? And then when someone does have to come in, how do you provide what will be limited, but at least efficient services so that you can limit the amount of time someone has to be in a dental office if they do need to come in? And really the important point about that is that it's really critical this time in our history to be able to provide the kind of dental services that will keep people from seeking care for all health concerns in some other component of the healthcare system, particularly emergency rooms. It's the last thing that other parts of the healthcare system need right now, or emergency rooms need right now, is people showing up with dental concerns that could be handled in a dental care system if we can set it up correctly. So there's lots of ways that we can begin to deploy telehealth connected team systems. I'll just contrast sort of two ends of what I might call a spectrum. One end might be what I'm going to refer to as optimized systems. These might be systems where they're integrated together in one sort of set of tools that might include all the things that are needed to be able to reach people, provide consultation, provide triage, set people up for in-person appointments, track what goes on, make a permanent record of all the things. And the other way to do it is to not go for the sort of maybe you call that the higher end or the more optimized system, but to try to put together just available tools. So that can be anything from email and text for your patients. Your patient could send you, some photographs and a text message, or there's a lot of off-the-shelf, low-cost, free, separate tools. There are video systems, Zoom, a separate system you can collect, have people fill out some forms, maybe another system where you can collect money, maybe another system where you can have people schedule appointments. Those are all possible. They're all out there. There are many dentists already beginning to put together their own little package of, I'm going to use this for this and this for this and this for this. And one of the disadvantages of those kind of systems is because everything's not all in one self-contained place, there's a lot of, if you want to have a permanent record of everything that took place, which you do have to have, nobody's relaxing those rules, then it takes a lot of copying and pasting all the different components and activities into one record system. So I'm going to focus a little bit more now, and I'm not to ignore the fact that there are some people who are not going to use the all-in-one systems and are going to be able to put together sort of individual tools like listed here. And I think that's totally fine if people do that. But I'm going to focus more on sort of the optimized system with the tools all together to give you a sense of what that's like. And if you ended up using one of those systems, great. If you ended up putting a bunch of things together yourself, that's also fine. But you'll have a sense of kind of the optimal way to do it, and may either use that or back off from it in various ways. All right, so when you start to think about how do you put together a system to be able to stay in touch with patients, I think these are the main things to think about. So one is, how do you notify patients that you have a system? And of course, that can happen in a lot of different ways. One being, if they're your patients and maybe you have their email addresses, you send out a blast to them over email saying, we're able to interact with you now over whatever system you have, and here's how you sign up for it. Here's what you do. Here's your instructions. Or look at our website, and we'll have the instructions posted on our website. Or if there are patients, if you're working for some kind of an entity like maybe it's a dental benefit company, and you have a lot of patients maybe who haven't really connected with the dentist so far, you could send out a notice to them that some dentists in the network have this capacity. You could set up a call center, and you could send out a notice if you have dental concerns. We're here for you. Please let us know. Call our call center, and we'll connect you with the dentist. And then once they're connected with the dentist, they go to the dentist's website and click on the link, and they start the process. So there's a lot of different ways to notify people that whatever system is put together is actually available. All right, you do that, you get the notification out. Then you got to plan both on a systems view. If you're a dental benefit company, you're going to link all these pieces together. You have a plan for how you do that. And then at the individual office level, you also need to plan for how you're going to handle these requests for help, and how you're going to set them up, and how you're going to schedule them, and how you're going to track everything. And then at the time where you're actually interacting with the patient, of course, what you want to try to do is to handle as many concerns as you can with just advice and consultation. And maybe for some people, they might have something that you would otherwise say, come into the office. But in this world, what you might end up saying is, well, why don't you try, let's watch that. Let's try some more palliative treatment. Maybe we'll set up another video conference for you in 2 days from now. I want to just be able to follow it. So you wouldn't have them come in as frequently as you might have in the world we were living in a few weeks ago. And then, of course, you're also triaging for trying to understand who those people that really need to come in now. That this problem is not something you're going to be able to help them with over the phone. They absolutely do need, it's urgent or emergent, and they do need to come in for care. And then if you decide those people need to come in, you really want to figure out a way to have those in-person visits be as minimum as possible, so they're really pretty much in and out as quickly as you can with a minimum amount of fuss. And we'll talk more about that in a few minutes. And then finally, at the end, you want to make sure that you have a complete record of everything that happened, because that is going to be critical going forward, both legally and for payment systems. It's critical to have a complete record of everything. So if you're using a bunch of different systems you put together yourself, you need a plan for how you're going to collect all that information in one place going forward. All right, so that's sort of an overview of the major, sort of the ideas of what to think about. I want to walk through now a workflow. So we'll first start out imagining you're a patient, and then we'll switch and imagine you're the dentist or the provider, which might in some cases be a dentist, might be a hygienist, but you're the provider. Start with the patient. So in this optimized workflow, first of all, you're a patient. You got notified somehow that this service is available from your dentist, or you call the call center, or you did something to see which your dentist would have the availability of connecting with their patients, and you figured out a dentist that you can connect with. You figured out how to connect that to that dentist because you went to the website, or you got an email with the link, whatever you did. So the notification is going to tell you how you get going. In an optimized system, you might be able to click a link on the website, and then you get a little opening for a patient portal where you register, put in name, and maybe it's just as simple as your name and email address, or maybe there's some additional information about you. And that opens up into a patient portal. And then you can start to do various things with the patient portal. I do want to recognize the fact here that there will clearly be patients in our society who will not be able to do that. There are people who just won't have access to it, even a smartphone. You can see the picture of the smartphone. These companies are making applications that work on smartphones or a computer. This is a system that's not going to work very well for them. There may be some people, depending on your patient population, that are not capable. But I feel like these days, it's pretty much the vast majority of people that would be capable of either on a phone or on a computer being able to get in and sign up for some kind of a patient portal in your system. All right, so let's assume now we're going to continue this conversation with talking about the people who are capable of actually interacting with a portal of some sort. So they register, you get this portal, they can choose a level of response, and so in some systems, these systems, that you can choose what kind of appointment do you want. Is this something you want advice within a few days? Is it something where you feel like it's really urgent? Your face is starting to swell, and depending on what you choose, other things happen. There's an ability for you, depending on what kind of appointment. Maybe there's a different fee attached to different things. You can attach a fee, or people either pay with a credit card, or they can enter their insurance information or Medicaid number right on the form, or indicate that they're already a patient of record in the practice, and that information is already available. They can fill out whatever other forms you want, so those can be customized for the office. So you can have them fill out a description of their problem. Maybe it's a health history. Maybe it's consent to participate in a video conference. Whatever forms in those, you can have a set of standardized forms, and then they can be maybe customized by your office. And then the patient in the secure portal can upload photos and text and any other records that they might have. I think probably many people have heard that the federal HHS has relaxed some of the rules around HIPAA, but I think you want to be careful about that. They're not all relaxed, and they're not going to be relaxed forever. And I think if you're going to start to use unsecure and not private forms of communicating with patients, you want to be very careful about how you do that. So if you have the option of doing it in a secure HIPAA compliant system, I think you're better off. And then finally, you might be able to have the patient if you set up a scheduler, when some appointment times that you're available for a video conference, they can click on the appointment they want. That's what the bottom right little image is. I know it's kind of small, but in the bottom right corner of that, there's just some available appointment times. The patient just clicks on one of those and they schedule their own appointment, or the office could schedule an appointment for them based on a phone call. All right, so that's kind of from the patient viewpoint. The patient, they hear that there's a system available. You have it set up. They get directed to your office. They click on the link to the system. They're into the system. They're able to register, upload their information, sign up, fill out whatever forms the office wants them to fill out, upload pictures if they want to, and then schedule an appointment based on the type and urgency of their concern. So now let's look at it from the provider side. So now as a provider, first of all, if you have a system that like the optimized ones we're talking about, you're notified when a patient registers and uploads something to the system. You can either respond as they're uploading the systems, either through the portal or through some kind of chat function, or you can just track the fact that they're following through. Or if they didn't fill out something, you want to text them back or through the portal, send them a message. They need to continue to fill out the form. They've chosen a time for a secure video conference, which is built into the system. So you're looking at the system in your office. At the right time, you just click the button to start the video conference with them, and they have the appointment. They have reminders. The system has all these reminders that they know, your video conference with your doctor is starting in an hour. The time of the video conference, they click into it. If you're still busy with a previous call, they go into a waiting area. Now it's time to interact with the patient. You start the video conference. And as I said earlier, the main focus now would be to try to be able to do what you can do to help them feel comfortable without physically seeing them in person. So sometimes it's just going to be advice, or sometimes it's going to be, let's watch that. Let me see you again in a couple of days. Or sometimes it's going to be, try this, or my tooth broke and it's a little bit sharp, and you may even give them some little home remedy for how to file off the sharp edge, because you can tell it's not any kind of problem that's into the pulp or anything else like that. or you may do something else to give them some kind of palliative care, and maybe you want to see them again in a couple of days to help see if things are going on okay, again with another video conference. So possible next steps, advice. Maybe there's a prescription you're going to call to a pharmacy or a pharmacy home delivery service. Maybe you're going to set up a follow-up appointment. But in some cases, you're going to decide, this problem is it's significant. This person's going to need to be seen. So your office is open for the emergency only system that's being recommended nationally. So this person fits the category. I really need to see them. Now, if you're not sure what kind of problems might be amenable to having them be seen or which kinds of problems you should try to put off, I think the American Dental Association has done a very nice job with this document, what constituted a dental emergency. At the bottom right there, it says latest updates, visit ada.org/virus. And you can see in the bottom left, this was updated today. So I went to look at it, and I had a version from 2 days ago, and I went and looked, and sure enough, there's a new version today. So they're updating this all the time. So this is actually a good, I won't go through the whole thing now. It's actually a good guide for thinking about what's an emergency, what's urgent. They have several categories of care, and then what's really a non-emergent where you should try to deal with it just through reassurance and maybe scheduling some kind of close or distant follow-up. All right, so now you've gone through that. You've talked to the patient. You've looked at this idea of is it really emergency or not or urgent, and you said no, it's emergency or it's urgent. We need to get this person into the office. All right, so let's think a little bit about how do you handle that office visit and how can the telehealth system help you in handling that office visit. So first of all, using the telehealth system, you've been able to be notified about all the things we just talked about. You've got an appointment set up, you've had the video conference, you set up the appointment for the in-person visit. The patient again gets a reminder of that. But here's, I think, the key thing, which is different than a lot of offices are doing right now, is if you can minimize the time in the office, that's the goal. So think about the idea of getting all the paperwork done and explanations and anything that might take some time in a normal office visit where you're sitting and talking or people are filling out papers, get that all done in the telehealth system. So with a system like I was just talking about, you can have the person after the video conference, you send them some more forms to fill out. So maybe it's a consent form for the procedure that you're going to do. You explain to them what the procedure is and how it's going to work, in as much detail as they need to understand it so they can sign the consent with the informed consent. Have a system where they can actually sign the consent form online and it's a valid signature. Maybe you've even given them their post-op instructions so they have all that ahead of time and going through what's going to happen afterwards. So at the time of the visit, instead of having them do the traditional office visit where they're coming in, they're checking in with the receptionist, they're sitting in a waiting room, they're touching the furniture, who touched the furniture before me, all that kind of stuff. The instructions are the person pulls up in the parking lot outside and they text or call you when they're there, and you tell them to stay in the car till you're ready for them. And when you're ready, you send them a text message or call them on their cell phone, and they walk into the office. They don't stop at the waiting room, no sitting in the waiting room. They walk right into the operatory. There's no paperwork. There's no explanations. There's no signatures. There's no filling out forms. All that stuff's been done in the telehealth system. So they sit in the operatory, you do what you got to do, and then they walk out again. And you've already set up a follow-up appointment using the teledentistry system. And so it becomes a very efficient, very in and out kind of system for them being able to get what they need to have done. And really the telehealth system has been the major component of letting you get to that point where you can actually function that way. You can do your consultation. You can do everything that's necessary to have that in-person visit be as short and sweet and efficient as possible. So thinking about the advantages of the kind of strategy, workflow, and systems we've just been talking about, certainly for the patient, getting a system like that, it's a sort of secure one-stop access to the provider. They go to the system, they've got a portal. This idea is certainly not new to the world of healthcare. And I've got 4 different medical providers where I have a patient portal. I was interacting with one of them today. So the idea of patient portals and being able to interact with healthcare is very common in general healthcare. We're a little slow catching up to that in dental care, but it's very, very common. For the oral health provider, it allows you to make contact with patients, remain in contact with patients. And I want to say about remaining in contact with patients, it doesn't only have to be when someone calls up because they've got a toothache or they've got a problem. Some offices are now beginning to think about, and I urge you to think about it as well, being more proactive and staying in touch with their patients. So there's nothing that stops you from sending out an email saying, we're still here for you. We know you had a recall visit coming up. We won't be able to do that in person, but if you want to be able to do that over on the phone or with a video conference with us, we're happy to see you. We can do sort of a visual inspection of your mouth. We can talk to you about any concerns you have. So to be actually proactive in reaching out to your patients so that you stay in touch with them and encourage them to stay in touch with you, even if they don't have something that they consider a problem at the moment. All right, so for the provider, there's just all kinds of ways to maintain contact with the patients. Then you get the full ability to provide this advice and consultation and triage using all the means that are disposable at a distance right now, which is conversations, uploading photographs, looking directly in the person's mouth through the online web camera, whether that's on a phone or on a web-based thing attached to a computer, providing consultation, advice, and triage, the ability to really plan very efficiently for the in-person visit, and be able to have at the end of all that stuff a complete record of all the images and forms and consent and payment all in one record that can be tied to the practice EDR. That's really the ideal system. And as I started with in talking about the COVID era, the other thing that's really critical is that the benefits for all this in terms of benefits to the healthcare system. How do you help people with dental conditions to receive advice or care outside of other parts of the healthcare system? We just don't want the other parts of the healthcare system now to be burdened with people who have dental problems or dental conditions, especially hospital emergency rooms. So I was also asked to say a few things about billing and coding. I'm not going to take very much time because I want to leave enough time for a good discussion with all of you who have questions and want to be talking about things. By the way, I should point out that if you're on the webinar system, there's a chat function or a question function with Steve mentioned at the beginning, so you can start to type in questions if you have them now. He'll be able to see them and he'll read those questions to me as we get into the Q&A part. But again, I was asked to say some things about billing. One thing I want to do is just point out to you that the American Dental Association, again, has collected, I think it's a very good set of billing and coding and billing guidance. They've updating it frequently. Here's the latest version, which was updated yesterday. And you can see the table of contents. There's sections on coding, frequently asked questions, technologies, services. There's a good consent form, so for example, for consent language about using virtual services. And then there's stuff about billing. I'll show you just a little bit of that, not again to have this be a complete training about billing, as I'm actually, for two reasons. One is I'm not the billing expert, and number two is it is very payer dependent. So depending on what state you're in, depending on what payment system you're working with, the billing and coding rules can be pretty different, whether it's a public payer or a commercial benefit program. So you really need to be checking the resources of the payer that you're working with. But I'll show you in a minute that the ADA is beginning to compile a list of the policies in place by various payers, which is really very helpful. So I'll show you that in just a minute. But here's an example of some part of that same guidance where they talk about coding. This is all from the CDT codes, but just to pull out some of the things that could be billed for now if your payer will allow it. Probably one of the ones that's going to be the most applicable for the world we're talking about now is the 1040, which is limited oral evaluation problem focused. And again, there are payers across the country that are now beginning to pay for that in a telehealth environment. Some are not. So again, it's very payer dependent. And then of course, there's the reevaluation codes, and there's codes on case management and the codes that the ADA has on teledentistry, either synchronous, real-time, or asynchronous. And again, depending on the payer that you're working with, they may want you to be billing one of the other codes for what you did in addition to one of the teledentistry codes, or they may be accepting a billing just for the teledentistry code. So that's very payer dependent. So I would urge you to stay in touch with the payers in your area. But again, the ADA, this is just the first page. It goes on for about 6 pages now, and they're updating it practically daily now of the policies in place now for various payers and what they're thinking about the benefits that they would pay for the various codes, and what about consultations and frequency limits. So they're updating all that stuff on a frequent basis. So that's the place to look if you want the most updated information about payers. I'll just end with this slide. Again, if you're starting to think about how do you plan for and how do you organize a system for your office where you're going to be able to interact with people and do all the stuff that we said. As I said from at the beginning, there's two ways to do it. One is you can get yourself a separate video conferencing system. You can use Zoom. Zoom is not particularly HIPAA compliant, but there's a BAA agreement you can put in with it. So there's some ways of using things like Zoom or other sorts of video conferencing systems. You could get your own scheduling system that's sort of separate. You could get a separate payment system. You could put all that stuff together, and many offices will do that. Or you can think about getting a system where all these things are put together. It includes registration and patient information and all the forms that might be needed and any kind of messaging with the patients and a way for patients to schedule their appointment or the provider to schedule appointments, reminders, a chat function, the ability to do the live video conferencing, if they're going to need something further to get consent forms signed, get all the explanation information signed, and make the in-person visit very efficient, and then have an integrated permanent record at the end of everything that's been done. And I'll just reiterate again, if you're doing this, this is all kind of delivery system aspects of my three-circle diagram before. Don't forget the modern prevention and behavior support science now, that while you're at this, the key would be to, if you're going to see someone, use the best prevention science. And in some cases, in a traditional office, you might have thought the person needs a filling or something more complicated, where you might have them come in and they get one drop of silver diamine fluoride and they're out the door. Now that might be your in-person visit, to try and make it as short as possible. And then all the stuff about helping them adopt healthy lifestyles and how they can handle that ongoing concern during a time where it's hard to get a more definitive set of procedures done, and how to make sure that they start to take exquisite care of their own mouth so they don't develop new problems or their problems don't progress. All that can be done through the conversations that take place on the video conference system. And again, using Matt Allen's motivational interviewing techniques that he talked about on the webinar last week, all that stuff becomes very important. But I think I'd urge you to think about integrated systems, whether you integrate them yourself or go to a company that has them all integrated. This is something that I think is going to get us through the next number of weeks or months, and I predict is going to have a long-lasting impact on the dental industry. People are not going to suddenly be using this stuff and get used to it and like it and then go back to business the way it was before. I think that this is the time when we're going to see sort of a fundamental shift in the dental industry towards using telehealth as a part of what we do going forward. And this would be a great time for people to get involved in it, begin to understand how it works and how you can begin to think about it for the current era, and then how do you think about morphing into the world post-COVID, and there will be a post-COVID world. How do we begin to expand our reach to the population using telehealth? And as we get closer to the post-COVID world, we may come back and talk more about that. How do you take what you've been doing during the COVID world and be able to morph it into something that would be applicable in the post-COVID world? So at that point, I think I'm going to stop here, and Steve, turn it back to you to facilitate whatever kind of questions there are now.
Okay, thank you very much, Dr. Glassman. Excellent presentation. And also, again, thank you everyone for joining. The CE certificate, unfortunately, is not posted in the handout section of your screen. The system would not allow us to post that while the presentation was in session. However, it will be attached to the follow-up email that's being sent 1 to 2 hours after this presentation ends. So your certificate will be attached to that email. Please look for it there. We will also be posting these programs on our website in the coming week. So if you'd like to review them there, they will be available for self-study CE with a few questions following them there. Look on our social media pages for the links to those, to that program. So let's turn to the questions right now. For starters, we've got a couple past graduates here from UOP and other had attended other classes that you put on. People say hello.
Well, hello to all of you.
The first question that I'll ask is there a toolkit available for other states to consider? Even though state laws and rules would change, this is a real solution to effectively utilize the dental team and increase access to dental services.
I'm guessing that question referred to the sort of the long-term view of the sort of the post-COVID world, although there's some application now. So I'll give you a couple different answers. So one is, if you're looking for long-term policy considerations and how do you get your state to adopt what I refer to as a policy environment, that's laws, regulations, guidance that allows this kind of system to be in place and to thrive. There's a paper that I wrote for the DentaQuest partnership on teledentistry. So if you do a search for my name, Glassman, and then Teledentistry white paper. You should be able to find that, and there's a whole section on it. I had some slides in this presentation about it, but I took them out just because I didn't want to run out of time for other things. It actually has a whole section about the policy environment and the things that should be enacted. And if you're going to be starting to advocate in your state, that would be a good guidance for some things that you should be pushing for. But also, I'd be happy to talk to people individually. I think there was 1,400 people signed up for this webinar, probably not all 1,400 at once, but I'd be happy to talk to people individually about actions going on in your state. And if you get a group that's going to be actually coalescing around policy and advocacy, to help work with that group to help you think about the kinds of actions you could take to bring your state into the world where these kind of things are possible. So that's kind of a little bit longer term. But shorter term, there are maybe more focused actions that could take place. I know the American Dental Association and other groups have been working very hard in discussions with dental benefit companies and payers. I was told that a number of dental benefit companies across the country, and I've had some conversations myself, are beginning to ask the question of, okay, what can we do right now to make a system like this work? And among the answers is one is the one I alluded to kind of in the middle of this presentation. I'd say if there's a dental benefit company that's going to do one thing, if they said, tell us one thing to do that would make a difference, I would say that they would take the code, which is D0140. That's the code related to a limited problem-focused evaluation. Take that code and make sure that that is payable, whether it's done in person or using telehealth technologies, and that the frequency limit is as often as once every 24 hours that people can bill for them. If I could just do that one thing across the country, I think that would allow people in every state to begin to do what we're talking about here. So that's kind of the short-term focus. I was talking about just a minute ago is more longer-term strategy for creating the right policy environment.
Okay. And you mentioned D0140 in that answer there. I'll expand on that. I've got a question that says, I'm an FQHC dentist. Most of my patients can't afford a computer nor have smartphones. In the instance where you're only using a phone call to triage treatment, is it acceptable to submit for the D0140? Would this also be acceptable for patients who are capable of video conferencing but decline to do so?
Now that is going to be a state-by-state answer. So, the billing rules that are for FQHCs are set at the state level. There's guidance that's come out from CMS recently, but the actual details of the implementation happens state by state. CMS has a guidance they come out with just actually last week, which is that they're urging states to adopt policies to pay for what they call telephonic telehealth, which is kind of a fancy way of saying a phone call. But whether your state does it or not, that's up to your state. In California, the way that has been implemented is that that FQHCs in California are now going to be able to bill for that phone call at a rate of $13 for the phone call. I'm doing a webinar tomorrow with the California Primary Care Association. If you're interested in joining, even if you're not in California, the link is, registration is available on their website at no charge, and you can hear it'll be kind of California focused in terms of the billing rules. The systems will be pretty much what I said today, but you can hear some of the ways this is being implemented in California. But also, again, state by state, but in California, if they're doing synchronous telehealth, where they're actually having a video conference, they can bill for that at the FQHC's encounter rate, which of course is a lot more money than the $13 that's being paid in the fee-for-service system. So these things are very state dependent, and so that means working with your primary care association in your state and figuring out either what has happened or what could happen and how to advocate for a system that will actually be workable for FQHCs.
Okay, very good. Next is several questions I'll combine into one. What are the HIPAA requirements with texting, emailing patients through systems like just simple text programs, Gmail, non-secure email systems, and are there any compliant options available, such as Google Voice or Google Business, those types of communications?
Yeah, so the HHS guidance about relaxing the HIPAA requirements and the privacy requirements now specifically says that it does not include email and text. So those are not HIPAA compliant and are not going to be. So while you may be able to use those to have some communication, you really shouldn't be sharing or any personal private information over email and text. The HHS guidance does talk about video conferencing systems, so they specifically reference things like FaceTime and Zoom, that those would be considered okay now in a relaxed HIPAA environment. They wouldn't be in the normal HIPAA environment, but in a relaxed HIPAA environment, which we're in now, things like FaceTime and Zoom would be okay. They specifically say don't use any public-facing video like Facebook, Facebook Live, or things like that. But I think in this area, you really want to be careful. Even though there's some relaxation, you want to be careful about doing things that ultimately, where you're going to store that whatever happened, is there going to be some record of it? Is the record going to be in the long-term HIPAA compliance? So I'd say for sure email and texting, no, but some other kind of things like Zoom and things like that as a single one component of what you're going to do might be okay for the time being.
Okay, very good. Next question is, what have you seen as far as Medicaid and CHIP utilization of teledentistry?
Again, we're talking about state by state variations. So there are a number of states where it could be possible. It has been possible for a long time. I've been doing this in California with mostly a Medicaid population for about 15 years. And actually the billing part kicked in about 5 years ago, where we were doing more of a demonstration project prior to that. So that's pretty well established. It's pretty well established. You know, you saw the map I had up a few minutes ago. The map was about the regulatory environment. That was the number of states that are beginning to allow, have a regulatory environment where telehealth is allowed and paid for. And most of those states did include the Medicaid programs. So that's starting to spread, but exactly how it works is different state by state. I've been doing this last year prior to the, again, back in ancient times, prior to the COVID, I was spending a lot of my time on calls with state boards and state regulatory agencies, giving advice about how do you actually word your regulations or the rules or something, because people are getting the idea we should allow this, but they want to know, now they want to know, okay, exactly what do we allow or how do we say it? And so there's been increasing understanding, increasing activity to make it allowed, but still very variable across the various states. So it'd be a matter, again, of talking to your dental association, your primary care association, seeing what they understand about the Medicaid rules, or maybe even the Medicaid agency directly, because it's very, very different state by state.
Okay, very good. Regarding informed consents, is it sufficient to only have a digital version? Does each informed consent have to be reviewed in person and verbally? And are there specific informed consent requirements during the COVID-19 crisis?
No, I've not heard anything about any changes in informed consent requirements or the legal definition of informed consent with COVID-19. People are relaxing lots of things, relaxing payment systems, relaxing HIPAA, but I haven't heard anything about relaxing requirements for informed consent. So that still remains. Now, the other question, though, was, can you do it digitally? Can you do it over a telehealth system? And I'm not a lawyer, so this will be my disclaimer. Talk to your own legal advisor, but my feeling is that the answer is yes, that there are systems where people can digitally sign things now, and if you're using a system where it's set up for that kind of thing, and then you review it with the patient over the video conference system, and you have a record of that is a fully compliant informed consent. And again, the informed consent has to include all the components that a normal informed consent would include, which is what are the options, what are the risks, benefits, and alternatives to doing what you're proposing. So as long as you've explained those to the patient, both verbally and then have them digitally sign something, I think you're in good shape. Again, that's, check with your own legal advisor about your own particular circumstances.
Okay. Many of the questions are actually focusing on which systems are optimized for teledentistry, which programs are recommended, which programs integrate with current dental practice management software such as EagleSoft and those types of programs. Can you give a high-level overview of some that function easily or that you would recommend?
I can say a couple off the top of my head, so I want to be very careful to say I'm not, both the two I'm about to say, I have provided some advice for these companies, so I clearly have to disclose that. And number two, this is not an exhaustive list. There's many companies out there offering various kinds of systems. I just happen to know a little bit more about a couple that I've been advising them. So one is a system called Teledentistry. It's a company that's called Virtual Dental Care, and their system, they've developed something particularly focused for this COVID environment called Teledentistry Communicator. It's sort of a light version that it actually does everything I talked about in the presentation I made a few minutes ago. There's a system called Mouthwatch, which has had pretty wide use now, that has many of these same components built into it as well. And there's other software out there that does similar kinds of things with a lot of the components, maybe not all of them, a lot of the components built into them. And then, of course, there's a whole list of ways to take off the shelf. I'm going to use this for video conferencing, this for scheduling, and this one for payment. And I recorded a separate webinar for the American Dental Association last week, and it's just been released on their website today, so you can go register for it. It's an on-demand system, which means it's a recording, and you can view it anytime you want to. And in that one, I believe that in the recording, there's also going to be the handout, which was available. And there's 3 handouts, and one of the handouts is a resource list, and it's got some companies that offer more of a full service system, and then it's got a bunch of companies for just the pick one of these and pick one of these and pick one of these, sort of the a la carte menus also on that list of handouts. So if you want to go access that was from the American Dental Association. It was on their front page. There was a banner, COVID resources, up until yesterday, and now you've got to go into the search box at the top and write in COVID to be able to see it. But or I think there's a link to something that says aea.org/virus. I think is a link to it now. But anyway, it's on their website. You can sign up for that webinar. You get CE credit for watching it, and then you can get the download of the handout, which has got the menu of both sort of the full meal and then the a la carte menu as well.
Thank you. During the presentation, you stated that you could do a periodic exam with telehealth. How would you accomplish an adequate intraoral examination?
Well, actually, I didn't say it quite that way, so I want to make the distinction. What I said is, if someone's due for a periodic exam, rather than just ignore them and not do anything, an option would be to call them up and say, you're due for your periodic examination. It was going to be scheduled for 2 weeks from now, but we're not going to be able to see you during this environment, but we can still check in with you. Here's the system we have. We can schedule a video conference. We can take a look around in your mouth, and we can, at least on a visual level, take a look. We can provide any advice to you, talk about how your health is going, just review things that have happened in the past. And so I wouldn't call that a complete exam, I wouldn't call it a complete exam or a periodic exam. I don't think it meets the requirements for either one of those, but I would call it a limited, problem-focused evaluation. If whatever the reason is that the person has some kind of concerns or things going on, or just to be able to make sure they're still in good health, that's their problem. Is they want to make sure that things are okay, and then I would try to bill it if your payer allows it as the D0140 done over a telehealth system. So again, I wouldn't call that a complete examination or a periodic exam, but I would call it a very valuable interaction with the patient that should be able to be billed. Again, based on your payer, should be able to be billed over doing it over a telehealth system as a way to do everything you can to keep people healthy and to stay in touch with them.
Thank you. And this question is a little different. Instead of the patient coming to the office and the problems of contamination via aerosols, why not have the dentist come to the patient's home, even though this may be more expensive?
Well, certainly that's a possibility. I'll give you, those are 2 possibilities. I'll even give you a third one, which is, let me answer that one first directly. The reason for not going to the patient's home is that you got 2 people who are going to be exposed to each other. Now, whether you determine that's a problem or not, I suppose that's an individual decision that you could make. It's not really the sort of strict social distancing or physical distancing that we're talking about now. If you had reason to believe that the patient had not been exposed and they're not, they don't have the virus, and you don't either, then I suppose that would be okay. But given the fact that people, it's almost impossible to not be out in public. People have to go to the grocery store, and everyone's doing it to some degree. So, and because people are asymptomatic, can be for, it's really unknown, but for a week or more prior to developing symptoms, you're certainly putting yourself at some risk. And then the ability in their home to do the full have all the full protective gear, you might be able to do it, but it's just a little bit more complex than doing it in your office. It seems to me if it would be easier, unless the patient has difficulty traveling, if you decide you're going to be okay being in person with them because they have an emergency. If it was me, I would do it in the office. But there's certainly, I'm not saying it's not possible, but that's the reason I would think you want to be cautious about going to someone's house. Another variation on that theme is there are people who are thinking about maybe they're going to reserve the office for really the true emergencies or urgent or emergency kinds of situations, but maybe they might do something where, outside in the parking lot, they're going to have be able to see someone where it's a little bit more of a, the one drop of silver diamine fluoride in the tooth. That's going to be quick and easy, and you're going to have minimum amount of things you have to do. So maybe you do that, outside in the parking lot, or you do it in a less complicated environment. So there's various ways of thinking about how you conduct some kind of in-person visit. And there's no right answer to that, but those are just some things to think about.
Okay. There are a couple of different questions about the hygienist's involvement in teledentistry. Is there a level of involvement with teledentistry for hygienists? Should that be some part of patient care?
Yeah, I think there's lots of roles that hygienists could play in this. And I'll just say a few of them, but I'm sure it's not going to be an exhaustive list. People are going to be inventive and think of even other things as well. But one is that the hygienist could be, depending on the volume of calls, it could be on the front line of the patient portal and staying in touch with patients, and maybe even the first person to get on the video conference with the patient. That would certainly be applicable in what's going to be the 6-month or the 3-month instead of the recall visit. Having a visit that's scheduled with the hygienist so they can talk to the patient about how they're doing and any complaints, and that area you're having trouble brushing in the back, how's that going, and all that sort of stuff can certainly be done by a hygienist. Even do a first level screening on photographs the patient uploads, and maybe use that as a way to determine, well, this one I think patient seems fine, I think we're going to just let it go at that, or maybe we need to get the dentist involved to take a look at this one. So there's lots of first level care and advice that hygienists could give. So it could be that. It could be if you're going to have some kind of limited in-person interactions, maybe hygienists could certainly have a role in doing some of the more patient education focused parts of that, the initial evaluation parts of that. And then maybe even if there's some procedures, depending on what it is, if the procedure you're going to do is going to be, again, a drop of silver diamine fluoride or a little bit of scoop and fill, if your state allows that, scoop and fill with glass ionomer and interim therapeutic restoration, those things can be done by hygienists, again, depending on scope of practice laws. So I think there's lots of roles that hygienists can have as a part of the team to be able to make the team function efficiently and stay as much touch with patients as possible during this time.
Okay, very good. Most of the teledentistry documents recommend video communications when possible. What about just telephone consultations, and how do those differ from after-hours emergency calls from patients? Are they billable differently than that?
Yeah, we did talk about that earlier, but let me just repeat it again quickly. Is that again depends on the payer and the rules and regulations in each individual state. So it's different state by state. Mostly phone calls are going to be less payable than a real-time interaction over video conference in the COVID era. There's some states that have billed for what's called asynchronous, where some records are uploaded, but most states have not until now been allowing any kind of payment at all for dentistry and telephone calls. So again, depending on your payer, your state, the rules and regulations that are in place, it's going to be pretty different. And I think the other thing to think about is I think that you're going to, if you're trying to actually understand what's going on with the patient, and you're trying to provide advice, and particularly if you think about that last slide that was in the slide deck that I showed, where you're trying to, I think I'll just put it back up for a second. You're trying to look at the at a system where you can get all of the components of it, which is the registration and messaging and all those things that kind of go together, so you have an integrated record at the end. You can do a lot better job with that if with some kind of integrated system, or at least a way to collect all the things that you did. So that's not to say there's anything wrong with a phone call. People have been answering after hours phone calls forever, and they certainly can continue to do that. And so I think some of the things that are presented here is sort of how to elevate that to a little bit more functional system during the next number of weeks or months or whatever it's going to be.
Okay, very good. Next question is regarding prescriptions. Is it advisable to prescribe take-home preventive products, and can you prescribe antibiotics to a patient without pain through teledentistry? Can we prescribe antibiotics to a new patient pain without an in-office visit and x-rays?
So antibiotics, yes, very careful about opioids. There's all, I think I won't have to talk too much about the opioid problem. So very, very careful about opioids, and you may not even be allowed in some states to do that without having an in-person visit with a patient. But certainly antibiotics can be prescribed, or in some cases, someone who's maybe the needs, you're going to recommend that they start on a 5,000 parts per million fluoride toothpaste, so high-dose fluoride toothpaste. Maybe you're going to write a prescription for that, or call a prescription into the pharmacy, and they're going to go pick it up. So pharmacies are still, in most places, opening and functioning for people to pick up prescriptions these days. So you can certainly do prescriptions after a telehealth system. Again, the more information you've had about the patient, the more you've been able to really understand what's going on with them. If you've been able to actually take a look in your mouth, and the more you really understand their problem, the more secure you're going to feel that it's an appropriate thing to do. And then again, of course, we hope we all need to still, we're not off the hook for balancing the problem with overuse of antibiotics. I'm suspecting there's going to be an increase in antibiotic use now because of the unique circumstances we're in, but I would hesitate to recommend people start to just freely prescribe antibiotics just because that's the thing you want to give someone something, and so be careful about that as well, because we're still, I think as this COVID era demonstrates, we're still at a war with the microbes, and we're not sure who's going to win that war. So be careful about antibiotic prescriptions.
Okay.
But certainly it's allowable. Yeah.
The next question, and I think we're getting down to the end here. Would establishing a relationship via teledentistry create an obligation, such as a need to provide emergency care or a need for formal dismissal with non-compliance with recommendations?
Yeah, so I'll give you, this will be an opinion. Again, I think you're going to have to check with your own dental association, primary care association, or a legal advisor about that obligation. My sense is that the answer is yes, that once you've interacted with a patient and you've taken them into this kind of care, that they probably do need to do something if you're not going to be able to, if you're going to not provide services for them in the future. But again, that's just an opinion on my part, and you really need to check with people who are in your state and your own sort of sources of legal advice.
Okay, and then this will be the last question. Using teledentistry in the long-term or assisted living facilities for older adults, where the nurses would be the ones communicating with the dentist and taking pictures or videos, do you have any experience or suggestions in that area?
No, but that's not the first time it's been raised. I haven't specifically done it, nor am I in touch with any. Although I do know someone who's about to start doing it, but I don't have the experience yet. Hasn't been happening long enough. But that's clearly a viable thing to do, and I predicted that's will be happening, and not just nursing homes, but other kinds of facilities like that, where people are in some kind of residential facility, and maybe someone in the facility can be entrusted to provide the information, do the uploads, take the pictures, help the patient stay in contact. So I think really there's room for lots of creativity here of ways that we can use this distance ways of staying in touch with patients and be able to provide effective services for them as we are in this era, which we're going to be living with for quite a while. So I think we're probably coming to the end. I know we went over a little bit over the established time, so I appreciate those of you who've hung in there. I know that this is at the end of the day Pacific time, so it's even more at the end of the day across the country and on the East Coast. And I just want to thank all of you for being willing to participate in this, to be creatively thinking about how to stay in touch with your patients during this difficult era. And again, if I can be of assistance to groups or individuals, I'd be happy to try my best to do that as we go forward. So Steve, I'll turn it back to you for whatever closing remarks you want to make.
Okay, well, again, thank you very much, Dr. Glassman, for the presentation. Thank you everyone for joining us. Be sure to like or follow us on our social media page. We have recorded this presentation, and we'll be posting it on our site. As soon as it goes live, we will post on our social media there. Your CE certificates will be emailed out to you in the follow-up email, and that should be delivered within 1 to 2 hours after the presentation. Thank you all for joining us, and we hope to see you on future webinars.